Hello, everyone. My name is Khalid and I'm from The Match Guy. And today I'm very excited to have a very special guest, Dr. Adel Al Hajj Saleh, talk about his experience matching into general surgery. Welcome, Dr. Adel, to our channel.
Thank you.
Awesome. So, can you please tell us a bit about yourself for the audience?
Yeah, thank you so much for the Match Guy family for hosting this, and I'm really happy to share with you my experience and my input about the entire journey. I might be one of those that you call non-traditional candidates because I had a prior residency back home in Syria. So I did my med school in Egypt, came back to Syria, did residency, 5 year general surgery, then went to Dubai for almost less than 3 years for like as a junior attending, and then came to the US for 4 years of research, during which I completed my USMLE. I had some publications, and then started with the prelim journey for like it took me three prelims to land a categorical spot at the end, and now I'm nearing the end. I graduate in a couple of weeks, and hopefully going to fellowship August 1st in minimally invasive surgery at Stony Brook. That's pretty much about my journey in a nutshell.
Yeah, that's awesome. Thank you. And first of all, congratulations into matching into fellowship, and I wish you the best of luck on that. So that's an interesting journey that you have, and I would love to talk a bit more about them. But can you please tell me a bit more about the step exam side? Like, how important is the USMLE step exams, especially if people want to match into either prelim or categorical positions in general surgery?
So step scores are very important, okay? But it's one of the things that they look at. It's like a whole package, and the interesting thing about USMLE or the US journey, I would say in general, that you can find two IMGs coming from the same school and maybe had the same score at their school, and then coming here they might have totally different experience, like totally different experience, like as if they didn't come from the same place. Having said that, step scores are one of the most important things that they look at. Of course, they look at other things, the year of graduation. Are you within the safe zone of like being within 5 years of graduation to be considered I would say like a fresh grad. Step scores now, it boils down to step two, because the step one is a pass or fail. Of course, try your best not to have an attempt. It's not gonna completely have you like lose hope, but it will make it more challenging for you to match if you fail step one or any step. But I mean, it's a pass or fail. You pass and then you move to step two. Now, step two has a lot of emphasis now because it's the only thing that is scored now. So they can compare you to your peers from the American grads and other people coming from outside. Um, so it's very, very important, especially nowadays. The American grads are scoring higher than before. There are so many unlimited resources to study from. People are getting smarter, of course, and the resources are getting more available. And having said that, even the USMLE Step 2 UWorld, for example, a question bank, is now nearing 3,500 questions. It used to be like 2,400 when I started back in 2017, 2018. So step two is very, very important. Now, of course, every specialty and every program has their own cutoffs for the step scores, right? And for example, I would say general surgery in general, 250 is an okay score to start with. Some programs might filter you if you get like less than 230. They don't even see your application. Okay. That can vary, like other less competitive specialties in telemedicine, although it's becoming more and more competitive than before, they can have a lower cutoff for the step score. Like 230, you're in the safe zone, but sometimes even you need a higher score to match in a better program. And of course, it depends really if you want to match in an academic versus community based. It's so many things. Also, like your experience, what you have done during med school and the years after. What's your volunteering experience? Have you done clinical rotations in the US or not? So it's not only the step scores, but step score is your invitation card to the interview.
Yeah, that's awesome. Thank you so much for highlighting the importance of step two. As you mentioned, it might not be the only factor that determines if a person gets an interview or not, but it is a very important thing to consider. And by the way, of course, for our viewers who are studying for the step one or step two exam, do not miss out on our high yield notes. These are gold. And the best part is that you can get them fully for free by signing up through the links I will leave in the cards above or the description of this video. Also, if you need one-on-one tutoring, we are very happy to help with that. I will leave the link for that in the description of this video. So, Dr. Adel, you mentioned a bit about the importance of the step scores and how, like, some programs might filter people out if they get like lower than average, let's say, for that specialty, of course, general surgery. So, what do you believe might help, let's say, push their application more to the more competitive side, other than these step scores?
You know, so there are a lot of things that you can do to make your application more marketable or more competitive, especially if you have like an average step score. I can't emphasize enough how important is having a clinical experience in the US. And unfortunately, electives are becoming less available, and a lot of people consider doing USMLE after they already graduated. So there's no room for them even to do an elective. There are sort of externships, of course, which is gives you a little bit of a hands-on experience, but they are also rare to find. The more common things to find are like observerships. So the clinical, experience in the US is very important because everyone looks great on papers. I will read your CV. Wow, this is impressive. But if I don't see you, I don't see your thought process, the way you think, the way you deal with a patient. Of course, if you're an observer, you can't really do a lot of clinical encounters, but I still can sense your thinking, your knowledge. I can see you functioning among a team, see how good team player you are, how enthusiastic you are, willing to do presentations, willing to help the team doing other stuff that doesn't really mandate a clinical encounter with the patient. But then I can really write you the letter with full, of course, everyone's going to be honest and credible when he or she writes you a letter. But I can write you the letter when I'm more confident, and a lot of time you will not know what's in the letter because you're going to be asking for it to be waived because that makes it stronger in your application. So clinical, observership or electives are extremely important. This is one, and the reason why, because they also get you in contact with the people who can help you in the future. It's not only about the recommendation letter. It's about the phone call or the email they will make for you during the process, the matching process. So that can really help boost your chances a lot if there is no room to accommodate you in their own program. Another thing that is really important, it comes next to the clinical experience, is the research. A lot of us, like myself, for example, after finishing residency and doing a few years of clinical practice, I can tell you I had zero research experience. Zero. I had no idea how a research can be done. When I came here for the first research meeting, and they knew that, I didn't know what IRB meant. I didn't know how to do literature review or something. Of course, step by step, you get those things done. And I wish that time that Match Guy was available with all the resources now, how to conduct the clinical research and all that. It wasn't there. That was 2015. But now I encourage everyone to even explore all of these on the Match Guide. They're very helpful. So research is important. Not only it can get you a few publications, but also can get you a lot of connections. Because when you go on a meeting, uh, a national meeting with your mentor, he or she will get you in contact with a few other people that can really make a difference in your future. And of course, they'll give you recommendation letters, and they will make some phone calls and email people for you. That'll be very, very helpful. So clinical experience, research. Some people do like masters, like MPH and MBA. I mean, I would say yes, they're helpful. It means that you're keen on keep going and progressing. But I think those first two are more important than that. And if you sometimes apply for the match and you don't match, then you need to look at what shall I do differently, and adding step 3 sometimes can be helpful.
Yeah, that's awesome. Thank you so much for this valuable info. And I'm glad you mentioned the research because that was like part of the reason why the Match Guy actually did those research courses, because a lot of people had problems or they didn't even know where to start. So we added like the research courses. And of course, for anyone interested in those, you could check them out on the practical ways on how to do research. You can sign up through the links in the cards above or the description below. And of course, it's fully risk free, which means you will get your money back if you are not satisfied. So, Dr. Adel, it's a good way to mention like how the importance of doing clinical rotations if someone is capable of, or if they aren't capable of doing that, like research would also help for the fact that mentors would actually know them and they would put in a good word for them either through emailing them or like directly contacting the programs that they applied to. So can we talk a bit about more about this topic? Like a lot of people don't know the importance of mentorship in this match journey. So how do you feel? How important is it, for based on your experience, the mentorship in matching into general surgery?
Right. Well, that's a wonderful question, and I'm glad you brought up this thing. So, if I want to talk about my own experience, I would say again, I am an older grad. I don't want to mention the year of graduation, so you don't think I'm too old. But anyway, I'm really an older grad, and having mentorship, of course, will help a lot. I didn't get the chance to do a clinical rotation in the US because I came right into research. I wish I could, because that might have made things a little bit easier. But when it comes to research, first of all, and again, the match guy can help you with that. There are a lot of videos and resources on how to choose where you want to do research and how to look for a research position in the US. The majority of IMGs will come for an unpaid research post that can be up to like 6 months or maybe 1 year, and then you can get paid. And some of them now actually becoming more available, the paid research jobs. So this is one. When you want to select a place where you want to do research, it should either be one of those Ivy Leagues places where people will not necessarily hire you for residency, but one phone call from them can change the world for you. Okay, like if you go to one of those famous places, Mayo Clinic, Cleveland Clinic, MD Anderson, any of those places, they can really help you with, recommendation letters they write for you and the contacts they have or they know. Or you want to go to a program where maybe they are not very well known, but they're known to have recruited the research fellows as their future residents. Those can be a little bit hard to find, but when you find them, your chances are very high to stay there. Now, the mentors are very, very, very important. Now, for example, if you're doing a research, it's the coaching, how to present your data, or they teach you how to think about relevant stuff, right? I really learned a lot from my mentors, from the very small things on how I present my data, whether on papers or on podium, how to prioritize, how to know the most important things. This is I'm talking about the research part. Now, of course, they will give you a lot of advice when you apply for residency and how to choose programs. Uh, it's very important to show them your personal statement. Very important. They are one of those people who usually review personal statements for residency applications. So their input is going to be highly valuable, and don't take it lightly. And, I would also encourage that this relationship stays, even if you match later, you need to keep this thread going on, because in the future you never know how you'll cross paths with them again.
Yeah, that's awesome. That's a very important piece of info. Like, for example, even if a person did get a research position and then hopefully they do match after the research years, they don't just forget like the mentors who helped them like solidify their match journey and like hopefully become residents in the specialty that they want. So that in the future, maybe, I don't know, they do fellowship in the program where they did research before residency, or maybe even start working with the same person who was their mentor in research. So that's a very good point to note. So what do you feel, based on your experience, was like something or tips and tricks in choosing or selecting programs? Because as also you might know, it's a new thing where now a lot of programs have the signaling. A lot of specialties have signaling. I think for general surgery, it was 15 signals last match season. So how's the smart way of navigating this new thing when applying to the match?
Right. So I think when we're talking about international medical graduates specifically, I would say if I want to apply for the match again, which thankfully I won't, but I would uh, not choose any geographical preference. Unfortunately, we don't have the luxury to choose. We want to match anywhere. If there is a program in Alaska, I would apply to it. There was none, but I would apply really very wide and very, and a lot of programs. I applied to a huge number of programs. As far as the signaling process goes, which we didn't have that time, but now it's started a couple of years ago. I would be realistic in how to signal the programs, because when you signal a program, a lot of time most of the people they send are the people who signaled them. So you really want to make sure how to use them very mindfully. I wouldn't, for example, throw signals on Harvard, Yale, Emory, although these big institutions, by the way, they do not filter and they read all the applications, they review everything. Like if Harvard gets 10,000 applications, they'll go through every single one of them, surprisingly. But of course, if I have a stellar step score, 260s, 270s, something, and I have like 100 publication, and people know me really well, and I participate in a lot of guidelines, a lot of meetings, a lot of then that time I would signal those programs. But I want to be realistic. I want to signal the programs first who are inclusive for IMGs, and this is easy to know. You just some regions are more IMG friendly than others, like the Northeast, for example, where I am right now, New York, this tri-state area, and around a little bit of also like Pennsylvania. In the South, you be careful. Florida, like more than Georgia, for example. In the Southwest, Texas, in the major cities, maybe, but other places, not. California is very tricky, very, very tricky. So it just also know where, you want to signal a program that is inclusive for IMGs, takes a lot of IMGs, and they have a good history of placement, like placing their prelims into categoricals. And you wouldn't know that unless you know someone in the program, or if you look at the residence profile, if they're updated, you look through the years like PGY 2, 3, 4, 5, and look at the IMGs. How many of those, like 10 categorical residents a year, how many of these are IMGs? Then you can do the math and you can know that, okay, I signal this program. Because one thing you should know, if I want to talk about general surgery specifically, 90% of the time, IMGs match as a prelim in the beginning. And then they get the chance either to stay in the same program as a PGY1 categorical, or they find like a lot, they win the lottery and get a PGY2 categorical somewhere else, right? Or they do like other things that we can talk about later. But your chance usually in the same program that you match at, like if you match PGY1 prelim in this program, your biggest chance is to match categorical in this program. So you have to use those signal, because you're not going to be looking only at this year, you're going to be looking also for the future if you're applying for surgery.
Yeah, those are also very all great points. And there is one point, to be honest, that actually caught me by surprise, because I always hear like conflicting evidence about it. Sorry, the one about choosing a region. So, for example, you said, of course, as IMGs, we don't have the privilege of choosing regions that we want. So we like have to apply broadly, especially when applying to such as general surgery. But some people say, for example, picking the regions with the highest IMG match rates, such as you explained, the Northeast region, such as New York, maybe New Jersey a bit, somewhere down the South, maybe Florida a bit. So wouldn't picking those regions as preferences help IMGs in matching, or it wouldn't affect them as much?
That's a wonderful question, actually. And in theory, I think you're right. I think you should maybe think about it. But then, practically speaking, what if you get lucky and you get a program in Iowa or South Dakota who are interested in you and they send you an invite and you match there? You never know. So
Mm,
of course, if you apply for the Northeast and the Florida and like those areas, Midwest, for example, which also another a good IMG friendly area, you'll be like, okay, I think I'm gonna apply here because this is the most important, area for IMGs. I mean, sure, you can do that. You might be eliminating yourself from other programs then that might be interested in you. So if I would say I can put no non-geographical preference and then choose most of my programs in the IMG friendly area and signal them there. But in the slim
mm,
chance that I get an interview somewhere that is outside those friendly areas, which might happen, because you have a connection there, or because you have done a rotation there, or because you just by luck they just look at your application and they liked it. It might be worth it to do that. Again, there is no right or wrong answer for this specifically. I don't think it really matters much for the IMGs, but choose your money, which I mean here the money means signals, wisely. Those are your golden
mm.
coins that you have. Choose them wisely.
Yeah, that's awesome. Thank you so much for that clarification. And of course, I wish the best of luck for applicants applying for this match season to apply smartly and broadly, especially for general surgery. So, as you mentioned a bit before, the importance of personal statement when applying for the match. Can you please tell us a bit about your tips when it comes to that specific part of the application?
Right. Well, there are a lot of things about the personal statement that are very important to know. Okay. So, first of all, and again, I'm going to mainly speak about surgery because I can't speak of other specialties. I mean, I know a little bit, of course. I have a lot of friends who match into other specialties, but I can give you the tips pertinent to surgery. So, first of all, you need to understand that surgeons, myself included, we have a short attention span. Okay, like we'll lose interest very quick. So don't make the personal statement longer than one page, please. One page only. Okay, no more than 4 paragraphs. Okay, start big, shocking statement, big phrase that is for either someone said it before, either like quoting someone, is it a proverb, is it something, and then like start giving an example right after that. And then of course you need to the personal statement, you need to give them an idea about the person that they can't see in the CV. They need to the person between the lines that they cannot see unless they meet or something. So it should show you rather than your application. Okay. A lot of us, it's called personal statement. So a lot of us have a personal story that ended up going into surgery or wanted to go into surgery. So that'd be nice to mention. If you, God forbid, had a attempt in step one or step two or any step, you have to mention something about it. And again, it's never an excuse, it's an explanation. Something was happening, family member had something, whatever, I had issue at school, something like that. If you have a lot of gap, if you have an attempt, if you switch med schools, that should be touched upon on your personal statement. And of course, you will tell them again what you want from the program to teach you, and of course at the end will be like showing the nice things you loved about the program, looking at everything and why you want to be a part of this program and whatnot. So after you write it, of course, there are so many ways. Like there are endless samples on available online to read and see what you want to write. This is first of all. Second of all, a lot of people are using ChatGPT. Okay, I'm not gonna tell you not to use ChatGPT, but do not copy paste. Use ChatGPT as your at your service to give you an idea of how it should be or something. But you need to tell it something like, I want to write personal statement about application to neurosurgery, but they need to know that I did surgical residency before. I had, experience in this and that, and I'm passionate about this or that. And then you just grasp the idea, but do not use the same phrasing. There's another sort of plagiarism coming out of ChatGPT, so people should pay attention. Okay, and you, of course, you have to have a number of people listen to it, especially if you are an IMG. English is your second language, not the first language. You need to prove it in so many ways. First of all, you need to show it to one of your mentors. You need to show it to one of your peers, maybe that you trust. You need to show it to someone who is non-medically trained or not related to medicine, but maybe a lay person, and someone who is native speaker, of course, to prove it for you and to tell you, oh, here you can say this and not say that, and here you can add this and not add that. So you need to prove it really 3-4 times with other people, medical, non-medical, and native speakers as well. And of course, again, the match guy have a dedicated team that can help you with writing your personal statement and your CV as well, which is also important. So the summary for the PS, short and sweet, 4 paragraphs, 1 page. Start with a catchy, like very catchy statement. The Charles Dickens said, "What the best of what the best of time, the worst of time," something like that. They start something big, and then start like narrowing down. Then from your experience as a kid, like you like to do stuff with your hands, whatever, anything. Some people were musicians, some people were painters, some people had a family member who had a cancer. Like a good story there, of course. Not a cancer is not a good story, but I mean the whole thing, the driving thing, and then yes, explain all the things that we said about, and don't make it sound like an article. Don't make it dry. Put your emotions, put yourself in it. Of course, don't overly dramatize it, but just make it, very nicely readable, and like people will really enjoy it. A lot of the time, the candidates will notice that many people get invited to interview people at the very last moment, so they literally read it while they are talking to you, or maybe 1 minute before they. So that you want someone to grasp the important things in 1 minute, maybe or less.
Yeah, that's awesome. Thank you so much for those detailed notes on the personal statement and the importance of it. And I would like to point out, like, some things that you mentioned. A lot of IMGs, especially, get it mixed up. For example, they say, "Oh, don't mention if you have a high year of graduation; it might look bad." Or don't mention a failed step attempt, for example, on your personal statement; it might look bad. So all those details are important to note that it should be done by a professional or a person who has experience in that. And of course, that's how, as you mentioned a bit, we, us at the Match Guy, we help with that. So for example, people who are applying for this year, you can download the personal statement and the LSTV samples that we have available for you. You can find them through the link in the cards above or the description below, and we'll get them delivered to your inbox fully for free. And also, if you need help with your personal statement, ERAS application, or even advice about the process, including talking to Dr. Adel directly, you can check out the links for the match application in the packages and for these individual services. So, Dr. Adel, pointing a bit more towards like some of your life story background there. A lot of people, especially when like they're interested in surgery during their med school years, and like they want to match into surgery, and they don't see themselves doing anything else. And they get into prelim years. For example, a prelim, as you mentioned before, like most IMGs match into prelim years instead of categorical. So can you tell us a bit more about this journey, what to expect, and include, and in these important years, how can we, let's say, guarantee the most that we'd be able to match into a categorical position when applying later on?
That's really I can speak about that for days and days and days. Okay, uh, having gone through it myself, and I can feel I can be in everyone's shoes and feel exactly what they go through when they match into prelim and then become desperate to find a categorical spot. But most of the time there is light at the end of the tunnel. Okay, and of course there are a lot of factors that the candidates don't control themselves. And here I really want to point something. I really don't want to digress on the from the mainstream of this webinar, but I want to say that a lot of us as doctors, especially IMGs, particularly people applying for surgery, a lot of us may be type A personality, right? And we seek perfection and all of that. Sometimes we can get a little bit harsh on ourselves. So just I want to say, be merciful to yourself. You've already achieved a lot. Coming to the US proves to people that you're already very inspired. Like just having made the trip and coming here to the US, right? And at a certain point in your life, there is nothing called failure because now everything you're doing, you're achieving and overachieving. Yes, there might be some hiccups down the road, but I'm really saying that because during that prelim years, people can feel like, oh, I'm useless, I'm worthless, or something. No, you're great. You did a lot. You got here. It's just a matter of luck. Sometimes the visa might be an issue. Oh, we would have loved to keep you here, but you're you're on a visa, and our program doesn't sponsor a visa, for example. So a lot of the factors are out of your hands. So don't be harsh on yourself. Please know your worth, and your worth is really a lot. It's priceless. Okay, now let's go back to the original topic.
Yeah, awesome.
Prelim, yeah. So PGY one prelim, I look at it in a very positive way. I look at it as an opportunity for people like me who didn't get the chance to do clinical observerships or electives in the US. It was the actual year of experience in the US, the actual clinical experience, because you're the doctor working here in this program. It will give you. So, first of all, I would understand sometimes why programs may want to match IMGs as a prelim, but although there are so many highly qualified people who should go into categorical right away. But like if someone who's old grad, haven't had a little bit of a gap, hadn't seen a patient in a few years or something, it might be good for the program to feel safe, like to give this 1 year and then see if you do fine, then they can keep you as a categorical resident. So a lot of time it's kind of justified. Now, the other thing is we come from outside the country with a great clinical knowledge and maybe experience. But a lot of the things in the US are different in terms of I always give this example. I didn't know in my life how to utilize a social worker or how to utilize the physical therapy service for general surgery or the occupational therapy. We didn't have that. Like back home or where I practiced in Dubai, the utilization of physical therapy was mainly for the orthopedic people, or ortho patients, but not for general surgery really that much. But here we learned how to utilize these services, all these important ancillary services. Now I can't imagine my life without having a social worker or an OT or PT, for example, right? So it takes you a few months to understand the difference in the system. That's why when you do clinical rotation here, it helps you to understand and may accelerate you adapting to the new system should you match as a prelim resident. So there are a bunch of differences. Of course, there are some cultural differences, things you and cultural sensitive topics that you need to be aware of, and a lot of them it's kind of difficult to ask. You feel a little bit embarrassed to ask. A lot of them you learn by observation, but of course, there is no silly question. When you need to ask something for your knowledge, you have to, because this is another problem that we face as IMGs. Sometimes we're a little bit too proud to ask. And let me tell you this, here you lose by not asking. If you don't ask, they assume you know. And if you know and you don't do it right, then this is not good. So always ask, okay? So you got the prelim position, you got adapted to the system within a couple months. Also, there are a lot of other things, there are a lot of struggles for the IMGs. For example, learning to use the AMRs. If you didn't do research here, if you didn't do anything here, and you don't have electronic medical records at your home country, then you're gonna struggle a little bit until you figure out how to write notes and do stuff and put orders. Although they do a lot of courses for you, but you don't learn until you do it yourself. Some people are fast typers, like most of the American grads would just look at the computer and be typing with two hands. Some people, like myself, it took me a little bit to be faster. I'm not like a very fast now, but faster, and to not have to look at the keyboard, for example. That this a lot of the skills, a lot of those struggles are, they don't know them here. They don't necessarily understand them here, but those are small winnings or small gains that every step of the way you will overcome. So unfortunately, in the reapplication starts in the beginning of the prelim years, because you start in July and you apply in September, and you have only less than a month to impress people, to get letters, to do, and some people may start on a night rotation that nobody will see them, and somebody might be lucky and rotate with a program director. So it you always have to balance things together. Prelim years are hard, and you need to impress people, you need to prove yourself, you need to make sure your clinical knowledge is fine, that translates into a good upside score. And also have to, amid of this 80-hour busy week schedule, you have to find time to craft your application again. So there can be a lot of challenges, but with the support, your family, your friends, and resources like the match guy can really be of utmost important and help during that, to help you boost your chances. There are a lot of resources to, of course, they're like Behind the Knife podcast. They have also YouTube channel for bedside procedures and stuff. There are some intern bootcamp and medical student bootcamp, and on their podcast, how to survive your July or the intern year or something. So there are a lot of things to be taught and learned, and I advise a lot of people now on how to improve their chances into becoming categorical residents. But really,
Mm,
prelim years can be painful, but also if you use them very well, they can really get you a golden card to your, and open your future wide, in front of you.
mm. That's awesome. Thank you so much for those valuable pieces of info, Dr. Adel. And I do agree we'd be more than happy to help, of course, whenever any applicant needs us, whether they're already in their intern years or their prelim years and would like to apply to categorical, we'd be more than happy to help in all steps of the way. So after an applicant finally gets done with everything, they finished their step exams, they did some research years, they did their personal statement, ERAS applications, and finally applied to programs, and they were lucky to get interviews. Maybe I think some people say this is the most important factor when it comes to the match process, the actual interview itself. So can you please tell us a bit more about your interview experience, and what do you think some of the best strategies are for the people to remember you during the rank order list?
Sure. So if I want to be frank and honest, the invitation card for your interviews are your step scores plus minus connections.
Mm,
Or I may put it the other way around. But anyway, connections are as important as step scores. Could be the same place that you're working at, could be in other places, or people you've known from the past. But also you need to know. It's not that if someone knows you will be happy to give you an interview. It doesn't work this way. It means that the person knows you enough to know that you're a very good candidate, and that his or her credibility will not be affected if they vouch for you in front of a program director, because these people care about their credibility a lot. So I can't say, for example, that Khalid is a great person, and then in the first 2 months you're struggling. They tell me, "Oh, why did you recommend Khalid?" I'll be like, oh, okay, I thought he's no, they don't do that.
Mm,
So it's a connection in a good way, not in a bad way. It's like not what people think. Oh, it's not like a corruption or something. No, it's totally the opposite. Okay, if they know you well, they know you're okay, and you deserve to be vouched for, then yes, they will make the phone call for you. And step scores, of course, are very very important, and we can't talk enough about that. Now the other thing is, when you go to the interview, it's all you now. It's all you. Whatever got you there was the invitation card for you, your scores, your CV, your connection. After that, it's your personality, the way you handle questions, the way you prove that your people will not be bored talking to you. Okay. Uh, in the program that I interviewed at, one of the programs told me, we really wanted to see you because we wanted to see the person that traveled like across three different continents, four different countries, like, and from Syria to Egypt, back to Syria to Dubai, now in the US. So some people are interested in the journey, and they see how persevered you are, or how persistent you are in achieving your goal again, right? um, so basically you want to be yourself in the interview. Of course, it helps a lot to do interview prep, and you can do it with your colleagues who are well seasoned and experienced, with your mentors. And if you don't find anyone, the match guy is, always, we will provide a lot of interview prep sessions, and you can look at the reviews to see how important they were and how much the people really benefited from. So interview prep is very important. The most usual and common questions, like, tell me about yourself, why our program, why surgery. You need to be uh, you need to know your program that you're interviewing at. Like, some people applying for internal medicine can get 20 or 30 interviews, and sometimes they may forget or not to focus much about the program. But you always should know your program. Like, look up your program very well at the internet. Look at what they offer, if there's anything unique about them. If there was a pre-interview dinner or social event, even on Zoom, the question that you asked the residents about, you can always bring up topics to show the program director or the person you're interviewing with that you're genuinely interested and you know a lot about this program, and there are reasons why you picked this program. So be honest, be yourself, know your program very well, try to be relaxed, don't like rush in your answers, and do not regurgitate your CV uh, during that. Like, when they tell me about yourself, I was born and raised in Tartus, Syria. My father is an ophthalmologist. My mom is a pharmacist. I have two older siblings. We had a great childhood. Something I enjoyed, watching whatever games and playing piano. Always, if you want the program director or the interviewer to ask you about something very important to you and can really make the difference in the entire interview, you can pass this line in that. Tell me about yourself. I
mm,
had a patent in something. I had established a charity for heart disease in Africa, whatever. Something big you want to tell them about, you can mention it there. And there are tricks, and you will find it in Dr. Asad's video as well. For example, if you want to show them you paint, like, there's a painting behind you, they can ask you about it. Or
mm,
if you want to show them you play an instrument, you can also put a poster for, you can just make it show in the background behind you. So there are a lot of strategies that you can use, but just most importantly, to be yourself.
mm. Yeah, that's awesome. Like, I do agree heavily on that. I know a lot of people myself who applied last match season, and like we used to host like interview preps together. And I did realize that, especially maybe it's common among IMGs, where we usually get to memorize the most commonly asked questions, such as the most common one, like they tell me about yourself. And then they start basically having this monotone voice of, oh, my name is Khalid, I graduated from here, I did this and this and this, and then that's it, like 1 or 2 minutes memorization as if it's an exam. And then when the program director or someone asks them like a question they did not expect, they get caught completely off guard. So that's why it's very important, I believe, to actually have the proper training for those very crucial moments that actually might affect your chances of matching or not. So if you are applying this cycle, if you must download the 200 or 200 plus interview questions and the sample answers to those questions. They are of course available free for you through the link that I will leave in the description below. And of course, if you need one-on-one help, if you'd like to talk to Dr. Adel directly or to any of our other advisors to help you with your interview preparation, you can schedule a session with them through the link I will leave in the cards above or the description below. And of course, it's risk-free, which means you will get your money back if you are not satisfied. So
So
finally,
back to this point. Sorry, before I
yeah,
don't want to cut you off, but just there's very important point. Being now on the other side, I got the privilege this year to help our program with interviews for one of the days, and you know, when we finish interviewing the applicants, we sit together, like the faculty and the residents who interviewed like 5 or 6 people, right? We sit together and review every single applicant to know from this day what is the outcome. Like if this recruit, for example, B, C, do not recruit, something like that, right? A lot of the discussion was, for example, Dr. Smith, what do you think about this applicant? He or she will be like, "Oh, I had a wonderful conversation with them. It was such a nice. I felt those 15 minutes were like one minute." Or one time, "Oh, he played pickleball. Oh my God, like my daughter." So we spent half of the interview talking about that. So sometimes those little things. That's why it's very important that you do not sound like a robot and just be regurgitating yourself and sounding like you're. I mean, yes, it's great to practice, but you need to leave a little bit of yourself in that. Body language is very important. Uh, Eye contact is extremely important. Smiling is really important.
awesome. Thank you so much for those niche details. It's very nice to know like what the other side of the interview process would look like, especially for new and upcoming applicants. So please, everyone watching this video, take note of these so that hopefully you get the best during your interview experiences. So finally, Dr. Adel, coming to the end of our interview, looking back, is there anything that you might do differently or any final advice that you would like to give our lovely viewers?
Well, of course, if we don't acknowledge our mistakes, then we don't learn. And I think it's very important to learn from our own mistakes. It's very good if we can realize others' mistakes and learn from them, because that we can avoid, falling into mistakes ourselves. But the one and most important thing I would say, do not come to the United States of America without at least finishing step one. I would encourage you to finish both steps. But once you get engaged in a clinical research that will mandate you to work 8 to 5, even if they gave you a little bit of a time to kind of study, but a lot of time you're working 8 to 5 and behind the computer, and then you're gonna go home and study. It's very difficult. Again, we're not robots; we're human beings. If you want to really give your best to the research or to the clinical rotations you're coming at, or all of that, you better get done with the step one and step two. Of course, during your research time, you can do step three, you can do other things. But I would say I would have finished that. Unfortunately, I had to do them during the research, and I couldn't really take a lot of breaks. But I mean, they were done, thank God, no attempts. But it was challenging. Okay, so I would do that. I would try my best hard to do a clinical rotation, because even if you are the greatest, physician in your home country, they still need to see 1 or 2 recommendation letters. I would say 2 out of 3 at least to be from the US. Of course, it will raise a question mark if you did a surgical residency somewhere and you didn't provide any input from there. You should maybe bring something, but very important to have at least two of the recommendation letters from here in the US. So make your stay meaningful, whether it's a clinical rotation, like make the maximum out of it. It's 1 month, okay to wake up at 5 every day. It's fine. You'll be fine, trust me. It's okay to stay a little bit later. It's okay just to jump for help for anything. Just make the maximum use out of it. Ask questions, learn, show enthusiasm.
That's awesome. Thank you so much, Dr. Adel, for all these valuable pieces of info. And thank you for joining us today. We really appreciate you taking this time to share this piece of advice with us. And for our viewers, if you'd like to talk to Dr. Adel directly or any of our other advisors, don't hesitate to reach out to our customer support team fully for free, who can guide you through our packages and how we can best help you. I'll leave the link for everything we talked about in the description of this video. And if you find any value in this video, I would really appreciate if you could hit the like button, subscribe to the channel, and hit the bell sign to get notified of whenever we post future videos on this channel. And before you go, please make sure to check out our ERAS CV tutorial that you can watch by clicking right here. And thank you so much for tuning in, and wish you the best of luck in the upcoming match process.